All right. This is your reminder this month again for EDAP. If you're not EDAP certified and you want to get EDAP certified, please reach out. You can reach out to Greg at IDPH and or the good folks at the RMSC on their website. Um, we're going to go ahead and start with our roll call. Starting with the hospitals, we'll start with Anderson.
Eric Brandmeyer is here for Anderson and Community Hospital, Staunton.
Thanks, Eric. Alton Memorial.
Good morning, this is Aaron from Alton Memorial Hospital.
Gotcha, Aaron. Thank you. Boyd.
Boyd, you say?
Yep. Is that you, Nancy?
Yeah, Nancy's here.
Gotcha. Carlinville Area Hospital.
Yeah, James is here. Good morning.
Gotcha, James. We got Staunton, Fayette County Hospital. I see Tina's room.
Morning, I'm here.
Gotcha, Tina. Thank you. Gateway. Danielle or Rick. Gateway. Okay, we'll move on to our HSHS partners, Holy Family.
Cindy's here from Holy Family.
Thank you, Cindy. St. Elizabeth's. St. Joseph's Breeze. And Highland.
This is Patrick here for Highland.
Thank you, Patrick. Jersey Community Hospital. Jersey. For Belleville, you got myself, Mike Gilbert, Lee French, Eric's here for Shiloh. Memorial Hospital, Chester.
This is Georgia. I'm here.
Georgia, thank you. OSF St. A's.
Yeah, this is Gary from OSF St. Anthony's.
Got you, Gary. Thank you. Redbud. Sparta.
This is Dale from Sparta.
Got you, Dale. Thank you. Touche Regional. Okay, we'll move over to the health departments. Bond County.
This is Wendy from Bond County.
Thank you, Wendy. Calhoun.
Megan Eilerman from Calhoun's here.
Thank you, Megan. Clinton County. Eastside Health District. I see you, Charmaine. That was you, I get. You came in broken, but I got you, Charmaine. Thank you. Fayette.
Kendra from Fayette.
Gotcha, Kendra. Thank you. Greene County. Jersey. Someone sounded like he spoke up, but came in halfway. Can you say again? And Tara, I see your note in the chat. Gotcha. Thank you for Redbud. Where were we at? Jersey County? How about Macoupin?
Derek here, Phil.
Gotcha, Derek. Thank you. Madison County?
Michelle's here.
Thanks, Michelle. Monroe County?
Vicky's here.
Gotcha, Vicky. Randolph?
Debbie's here.
Thank you, Debbie. And St. Clair?
Kara's here from St. Clair.
Thank you, Kara. Our community partners and IDPH, we'll start with our RMSC. Greg?
I'm here, Phil.
Gotcha. Thank you. Our emergency response coordinator, Beth? Thought I saw Beth in the chat. Are you on, Beth? You are unmuted. Maybe you're double muted by chance. But I see you nonetheless. So maybe we get that sorted out before your turn. The Beth's here. Any of our BJC partners? EMAs. Any EMAs on this morning?
Jason with the Illinois Emergency Management Agency.
Gotcha, Jason. Anyone else? Once, twice, thrice? Okay.
Mike Hershey with Illinois Emergency Management Agency.
Okay, specific county or just with
I work with Jason.
okay. Gotcha. Thank you. We'll go to some of our EMS partners, MedStar.
Chuck Kelly's here.
I got Chuck, and I think, was that John in the background? Who else?
Yeah, that was John.
Gotcha, sir. Thank you. Abbott. Any other EMS agencies on? Okay. SLU Hospital.
Hi, good morning. St. Louis University Hospital is present.
Thanks, Helen. Gotcha. Anyone from Scott Air Force Base? Not sure if Tim's on this morning.
Hi, John Mack is here for Scott Air Force Base, Emergency Management.
Okay, Johnny Mac. Okay. Gotcha. Thank you very much. And any of our STARS partners on this morning? All right. If you were missed and want to make sure you get claim credit, we'll pause for a second just in case we missed you going through the first iteration, or if you're not listed and would like to be announced, we'll pause here for a quick second.
Hey, Phil, it's Sean with BJC.
Thanks, Sean. Appreciate it.
Also, Rachel Laird here, affiliated Alt Memorial.
Gotcha, Rachel. Thank you very much. And there was someone behind you, I heard.
Brody at South City.
Okay, thank you very much.
Courtney here with St. Joseph's Highland.
Thank you, Courtney. I think we got some more folks in the chat. Yep, okay, I got you, Brody. And thank you. Okay, we'll go ahead and get started. If you are here and want to get, make sure you get accounted for, please just put it in the chat while we move forward with our traditional agenda. All right. We got pretty much standard update. Today we'll start with Greg at IDPH.
Good morning, everyone. Hey, Phil, I'll let you just handle the update of where we are with the HPP grant. So I really don't have, I know there's some EMS on, a couple coordinators in that. I believe they're going to send out a reminder, even though this is kind of old news, regarding the monitors and defibrillators and AEDs that are at their end of support. I believe that was actually February 3rd of this year, but they will be sending a reminder to the coordinators. So just in case some people may not be aware of it, I ask those coordinators to please make sure the providers get that notice. For the EMS rules, they are in second reading, or that is the last I heard. They should be coming out, and those would be new EMS rules that are based on the emergency EMS rules. So a number of those rules will be being made permanent, in addition to a few rules that were cleaned up, and I'm sure we'll go over those when those finally get done. And other than that, Phil, that's all I have.
Thanks, Greg. Any questions for Greg? Okay, hearing none, we'll move over to Beth. One twice for Beth. I know you're on. Let's see. You show us that you still show unmuted, but we're not hearing you. Well, if Beth, if you do get your audio back, just let me know. I'll pause here for any other public health announcements. Okay, we did forward out, I will say this, we did forward out a note regarding the CDC's laboratory testing for Ebola, that webinar, which is upcoming. Let me double check that's actually tomorrow, the 3rd, at 10:30 in the morning. So that's regarding lab samples and a few other things. So definitely would encourage the hospitals who are on, if you have not registered for that, please take a look at that meeting that I sent out and register for it. All right, looks like someone said they joined. I'm sorry. Just trying to check who that is. Okay, gotcha, Danielle. So Gateway's here, not a problem. All right. Again, any other health department related information? Okay, hearing
Beth
none.
just texted me that her microphone is not working, so.
It's shy. If you want to call in, Beth, feel free to just call in on the provided line in the invite, and we'll get you squared away. Just remember to mute your speakers on your computer so we don't get a lot of feedback. But we'll catch up with you on the flip side. We'll just continue to move forward. All right. Any of our STARS partners join while we were late by chance? No? No, STARS are going through a few changes on their side, so we'll move forward. Any REMER updates?
This is Brody with South City Hospital. I was voted on as a training and exercise liaison with STARS. So if there's any of that, I could attempt to relay that back to STARS.
Okay, well, no, thank you, Brody. We appreciate that. I know Lee attended one of the last meetings over there, so if at any point in time you have any specific information with regard to training and exercises, and if you have any now, you can feel free to relay it. I know you're new in that position, but this is definitely the place to share that information. All right.
Sounds good. Yeah, no new updates on my side right now.
Okay, thank you very much. All right, did Mike jump off? Mike, you got any REMER updates?
We're just working on training. We've got a training with St. Clair Special Services Hazmat Division on Monday, doing a large chemical plant exercise where we're focusing on patient decon and patient treatment prior to transport. So it's we've got a bunch of support coming from the WashU EMS fellowship program. Their faculty and their fellows are coming out to help, along with our docs and our PAs that are coming out to help with us. So it's going to be a good evening of exercising the ability to decon and treat patients before transporting.
All right. Thank you, Mike. Any questions for Mike? And as always, for a plug for REMER, if you got folks who are interested in, being, doing something a little extra for the region or looking for a volunteer opportunity, it's a great organization to be a part of. All right, general grant status updates. I didn't put any full slides in here because I'll be honest, since last month, I got no real updates. Part of what we did discuss last month was the pushing forward with training and education. So that training portion of our plan is moving forward. You will see, if you haven't saw them last month, you'll see them again this month, the upcoming training dates. And we'll talk to those here at the end a little bit. This morning, matter of fact, this morning I did receive another update on the facility we talked about. We are moving into a facility into Executive Park here in Fairview Heights. And we will really be neighbors with Greg and IDPH. So that's going to be great. That's going to be our new warehouse, one of our new warehouse locations. And I approved the layout and design after our meeting. We had a meeting just after our meeting last month. After our coalition meeting, I had a meeting with the realtors and folks at BJC, and kind of gave them the last updates of what we wanted to see happen. So that's going to move forward. And I just approved those this morning. So that's a good positive. From my understanding, 3 out of the 10 RHCC grants have been approved, I think as of yesterday. So they are moving along through those. I would presume that ours would, probably for the first time ever, be fully executed before the end of the year. So in the month of November, I'm looking for ours to be approved, which means that gives you guys, those who did submit project requests, more time this year to get that information back. I know the good folks over at the Grants Management Office at BJC have been working hand in hand, but this will get you guys more time to get that paperwork squared away and an opportunity to execute those funds in a much better time frame than we've had in the past. For those of you who don't know, history would say that we would have an executed grant somewhere around between February and early April, which doesn't leave us enough time to execute on a lot of funds, and sometimes we had to send money back to the state. We don't like to do that. We like to be good stewards with that money and execute it how we have it outlined. And I think this year will be the first year since I've been here that we are going to actually execute it on a somewhat rational timeline. So that's good because we're already executing those funds on training and the facility. Next thing is project requests and whatever equipment requests that we kind of have out there. So good news, at least with regard to the grant. So any questions regarding the grant?
Hey, Phil, it's John Nowak.
Go ahead, John.
Hey, sir. After we had our meeting a week and a half ago over the Ebola, and I know you'll probably get into it a little bit here. Lee directed me to Members Planet to find that project request form. I cannot find that. So if somebody can help or direct me in the right direction.
Will do. Nope, not a problem, John. Yep, and as a reminder for that, yeah, and it's on the last slide as well. The deadline to submit those project requests is 31 December each year. And Lee, if you could just throw that in the chat, that would be great. So John and the rest of the crew can make sure they have it. But yes, you want to definitely make sure you get those project requests in before the deadline.
Yeah, I can't find it either. This is Nancy.
Okay, we'll do. We'll toss it in the chat, and we'll also, when we send out the link to the YouTube, we'll put the link in that email as well. All right. We're going to talk a little bit about our redundant communication exercise yesterday. Yesterday, we conducted one of two of our required redundant communication exercises. The target organizations were our hospitals, EMS providers / system coordinators, health departments, and emergency management agencies across the region. As outlined in our TICP, these are our mass notification methods that we have available to us. Member Planet, which we were just discussing a second ago, is kind of like our primary go-to. As we kind of talked about many moons ago, before we jumped on starting to use a Member Planet, trying to routinely navigate or maintain distribution lists became very, very monotonous and difficult. And using Member Planet is our preferred method because it gives you, the end user, the ability to, one, update your information as it changes, and two, if you move on from a position that you're currently in, you can just close your account, and then we know that you send us an email, but you close your account, and then that automatically removes you from any mass notifications that we would send out via Member Planet. Our second means of that communication is EM Resource, then Everbridge, Siren email, and I'm kind of leaving Starcom as kind of a separate entity. I'm talking specifically our mass notifications that we would actually try to hit you on a phone or mobile device / email here, but Starcom is still a fallback method as well. So those are the tools that we use, and the goal of this exercise was to kind of basically clean up some of that member planet data and ensure we have a good fallback in case we need to receive status reports or other information from your organization. So our regional, which you see there, those two faxes are from our December 14th, 2021 redundant communication drill. So we asked organizations to fax us copies of the hospital status reports, and that's kind of a look at one of those. So out of what we can tell you, that when we went through this exercise, and we kind of knew some of this because we use Member Planet routinely, is that of the 128 active accounts, 36 emails were bounced or failed. Okay. These are a list of the users who had bounced or failed emails. So if your name was listed here, Member Planet was unable to reach you initially. So we did send, or you guys probably know, probably about an hour or maybe an hour and a half later, I sent out a mass email notification to everyone with the same information in it, because we started receiving those. That's what we would do on a regular day. We started receiving those kickbacks. And the reason I do that, or the reason I sent that second notification via traditional email, is because, and I use the exact same data. I take the information that's in Member Planet, but we do know that some organizations, for whatever reason, have blacklisted the info@swillhope.org email address. Sometimes that happens because we send out, multiple things from the same address, and they can tell that it goes to multiple people. So your spam filters may automatically catch that because they're like, oh, this is like a group spam. When you guys receive emails from me, you always see it as it looks like it goes to nobody, but I'm blind courtesy copying, so I don't send everyone's email address out. That's what you guys receive from me when I send it an email. But the back end of all of this, the widgets in the sky or the computer in the sky can tell that this is a mass notification, and your organizations, doesn't want everyone at their organizations to receive spam. So some of those spam filters have clicked on. So you may have not received the Member Planet version of the request for that information in the drill, but you received my version. So I got emails back saying, hey, I didn't get this through Member Planet. I didn't get this through Member Planet. Da 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 da. And we worked with some of you. I will use Georgia as an example down at Chester. We fixed whatever was going on with hers, and that part of that was on our end, because Member Planet also has a function in it. Whereas if by chance there are several bounce backs or unread messages going to an email address, it will basically time you out. It will basically say like, all right, well, you're not getting any responses from this individual, so we're not going to send to that individual. So that's what happened with Georgia yesterday. So it wasn't necessarily her spam filter at her organization that was blocking it. So we were able to rectify that. We were able to rectify that on a few others, but still there's some that we can't. It's not on our side where we can't help. So if your name's listed here, please double check and work with your teams at your organization, your IT folks, and let them know that, hey, I'm not receiving stuff from info@swillhope, and they can whitelist that to make sure that you get that information. Sometimes people accidentally send it to junk mail or spam or something like that. So please be careful with that as well. This is what a full hospital status report looks like. When I showed you this black and white one, but this is what the full status report looks like. And again, it's primarily for hospitals, and it's in Appendix B of the regional EOP. Okay. As far as the organizations that we were successful with connecting with, we kind of have a kind of targeted group. The four primary coalition members being hospitals, health departments, emergency management agencies, and EMS. We were fairly successful. I'll say we were fairly successful in this. The first slide that you see on the left with the yellow Okay, those are folks that we want to have in. We could not definitively say that we have a point of contact at those organizations. You know, AirVac, Arch, Dupo, EMS, yada yada yada. We don't have a definitive contact inside Member Planet now. And if you're on and may have not have created an account, please make sure you create an account with us. Again, we'll put that in our email that goes out, the links to get to our Member Planet site. You can always get to it by going to swillhope.org. If you go there and just click on the member login button, it will take you right to Member Planet. So you can always get there that way. But the one on the right here, we remove those yellows because we know we don't have definitive contacts for them, but that's where we kind of want to be. And when we look at our EMS providers, we really look back to the organization. We think it's probably best that the system coordinators forward that information on. It's great. It would be great to have everyone in. Every EMS agency, transport and non-transport, would be great to have in Member Planet. But we do understand that that's probably not that realistic, that we'll be able to get all of them. So I do look to, or I would ask that the EMS coordinators, if you get something like this as far an exercise, this would help you as well. I would ask you guys to follow up, to send that to your distro list that you may have, and say, hey, participate in this exercise, please, and send a fax. In this case, send a fax to the number listed below, just a cover sheet. Because again, we're just looking at, again, why it's called a redundant communication exercise, is that we're looking for those failure points should or when a primary means goes down. And those 6 listed primary means, if one of those goes down, how do we get to the next one? How do we get to the next one? How do we get to the next one? And still communicate effectively across the region. I know we got some folks, I got some notes back saying, well, I could not find a fax machine. We don't have a fax machine. That's understandable. We understand that, but we need to know our limitations across the region. And this is what those exercises are designed to do. You will also see that there we did have a few others that did come through. Gateway Home Health, Chestnut Health Systems, American Red Cross, and South City. So Brody, that's probably was you when you received yours. So we appreciate you participating, and your names, your organizations. These lists are attached in the AAR, which we'll send out after this meeting as well. We're just finishing that up. So that will be in the follow-up email to this meeting. So I see Lee has put in the project request link inside the chat. So if you were looking for that, that is in the chat. And I'm going to put in our traditional webpage, our swillhope.org website there as well. You can copy and paste that, and again, that will take you right to the Member Planet login if you need to get a Member Planet account. Lastly, with regard to this exercise, before we get to our open floor, with regard to exercise, is that most of you, I think there are 53 organizations within Member Planet, or individuals within Member Planet who have email information but don't have a mobile phone number. We do send out mobile text through Member Planet and Everbridge. So if you want to make sure that you're able to get those texts, because maybe your email doesn't receive it, your text message may receive it, so you don't have to worry about being whitelisted, blacklisted. That's another means for us to communicate with you. I ask that you go in and update your profile information at least once a year. Just take a look at it. We do these exercises twice a year, so these are perfect opportunities to go back in, make sure you've got a phone number, a mobile phone number that we can reach. Okay, so please do that when and if you can. I'm going to pause for a second for any questions, and then after that, we'll see if Beth is able to speak now with calling in. So I'll pause for any questions with regard to the exercise yesterday.
What was the exercise on yesterday? We sent an email and then we had to send our best count in.
All right, not hearing no questions. Beth, were you able to call in?
I think my email's the only email there.
Beth, this is a second chance, by chance. If you are speaking, you are muted. And third chance.
Can you hear me now, Phil?
Gotcha. Perfect. See, that's why I waited. Perfect.
Yay.
Gotcha. All right,
All
go
right.
ahead.
Just a few things that we're doing at IDPH and the local health departments are doing. Last week we did some radiation training. This is with the local health departments, and I'd like to thank the coalition for loaning us a few rad instruments. We started the preliminary planning for Eclipse. That'll be about 18 months out, so mark your calendars. And I think everybody knows by now, but the regional office has moved, so Greg and I are now in Fairview Heights. We are in the process of getting our STARCOM radios updated. We had our radio guy, Chris Cochran, do some training for the health departments, and he is taking radios back and updating them and then bringing them back to us. So this is going to be a long process, just so everybody knows. Tomorrow there is a tabletop exercise in Grafton on flooding. I think it's just a limited audience. IEMA is hosting. We did a BioWatch exercise a few weeks ago, just starting to work on the after action report. And I am too trying to get all my distribution lists updated. Didn't realize how many I had until I started updating them, and you are correct, it is a bit of a job. And then the only other thing I wanted to mark down was, I think we've talked about it, monkeypox. We're not supposed to call it monkeypox now, we're supposed to call it MPV, in case you didn't get that message. And the best for last, Ebola Sudan. Anyone from those areas of Africa are being flown through 5 airports in the United States through the CDC quarantine station, and one of them is Chicago. Right now we have no cases of Ebola Sudan in the United States. So that's all I had, unless anyone has questions.
Hey Beth, quick question. I know we don't have any definitely active cases, but the number of I don't know if PUI fits for that, but where are we, those who have been quarantined or under some form of surveillance, how many is that right now?
I do not know. The numbers are so low. I don't think they're talking about it much because they want to be careful not to identify anyone or give out enough information that people will figure it out. So I do not know.
Okay. Any questions for Beth? I do have one thing after that before we open up. Okay, well, thanks, Beth. We did, as John was kind of pointing out, a week and a half ago, we had a meeting just here in St. Clair County. When I say St. Clair County, we had St. Clair County local health department, MedStar, and my team here. Just kind of a little round table talking about Ebola. And there's things have changed, over time. And the meeting, what we were, the primary impetus of the meeting was to, one, just get folks, hey, how you doing? You remember Ebola from 2014? Yep. What have we learned since COVID? Yada, yada. And the goal for me was to try to capture what we believe, how we should be communicating, because these are going to be changes in how we initially execute to what we do in our high consequence infectious disease plan, our air quotes Ebola plan, and how we keep folks on the same piece of music. How do we, the scenarios were basically two. One, those surveillance folks that go through the quarantine airports and are identified, as Beth kind of outlined, and then those who have made it back to their home of record by way of Uganda or South Sudan or what have you, but were not on the radar of the health department or IDPH or any health department for that matter, and made it back here, and how we kind of deal with that. And again, looking at it from a checklist kind of standpoint, what's the first thing we're going to do, second thing, third thing, yada, 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 and how we're communicating that. So there's going to be more to come with this. We are leaning a bit forward. I know there's some organizations. I was in a meeting that I think my one of my infection prevention folks put together just came out of the blue, and she was running down a list of things of what we're going to do here in the hospital and da 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 da. Do I think we're at that point yet? No. But it is always good to kind of knock the cobwebs off just a little bit and start some of that discussion. So that is something that I would recommend for other EMS system coordinators and the hospitals to just kind of start thinking about, what are we doing? What are we doing that's different than what we would do for COVID? And are we prepared to receive a patient and know what to do when your triage algorithm tells you that, oh my God, this person may be someone who is highly likely to have potentially contracted Ebola on their travels and made it back here to our community and are now in our ante room in the ED or in our negative pressure room in the ED. What do we do next? So John, did you have anything that you wanted to discuss about that, or anyone, or Kara from St. Clair County want to talk about with regard to that meeting?
Well, Phil, this is John. The only thing, again, it was great to have that meeting to kind of put us back in that thought process, the what if, which of course, after we got off that meeting, myself and Chuck and a few others, we've had some discussion. And we went back and looked through the plans. The last time we updated was 2019. We even got in and went in and looked at the Missouri plan to see how, if they had updated theirs. Theirs was updated. And looking through these plans, there are many questions out there, and I know we can't answer them right now. But some of the biggest, for like us in EMS, if again, we don't even know who our assessment hospitals are right now, or if they're up to date. Not just Illinois, but I can tell you Missouri's having that same issue, even though their plan says it's updated as of February, whatever, of 2022. They're still not clear on whose assessment, whose treatments. Well, we kind of know who the treatments are, but actually as assessments, there's just a lot of questions out there still that I think, even as far as, we go back and we look at our plans from 2014, 16, and even when we kind of brushed over them in 19, it's something that I don't think we need to just let lay. I think it's something that we need to keep up with and get these plans up to date. Because there's so much more that you have to do. EMS in a transport situation. What all do we have to have in play to make a safe transport from, point A to point B, with 10 miles between those 2 points or 500 miles between those 2 points. So there's still a lot that we need to get together and get some of these ideals and get the things put together in the plan. I don't know if I made sense on any of that, but if you go back and you look at, even, like I said, I like to look at other people's plans just in case, we're missing something. They're all in the same boat. I mean, some of the biggest questions are who is actually participating now?
Indeed. So yeah, I know the state is still whittling down that list. So Greg or Beth, I don't know if you guys, I mean, last time we talked with Ashley, that was the thing, is that, we're getting the list of assessments, hospitals, et cetera. Has that been finalized, do you know?
I am not aware that it has been finalized. As you know, that I sent out to our two transport providers who previously had committed to still see if they needed to. I believe everybody is a front line, as I understand it, in our region. Previously, the treatment, they had one in Champaign at Carl, but they have decided they are not going to be a treatment center anymore. So I think they are trying to find what the assessments. I think we only have 3 hospitals in the state, all in the Chicago area, one a children's hospital and 2 hospitals that are treatment centers. But quite frankly, I don't even know what's going on in Missouri. It was so hush-hush previously. I only knew of a treatment center in Kansas City and never heard if any of our hospitals in St. Louis were assessment or treatment centers. And so that was a struggle because I really got pushback from the corporate people who didn't even want to tell me what was going on in St. Louis. So, I mean, I agree. We need to get together on this. I know previously, back in whenever it was the earliest one, there was talk of stripping an ambulance down and having an ambulance follow with all the equipment and stripping an ambulance down. But I don't even know what the plans are at our 2 transport providers, if they have a plan. So I just would remind everybody that those plans should be shared with EMS and, well, basically both Beth and I, so that we follow whatever plans you guys are coming up with and moving towards, that they meet regulatory requirements too. So perfectly happy to, participate in those conversations. And, if I can find out more from Missouri, that would help both Beth and I as to what's being planned down here. And why I'm saying that is some hospitals said, well, don't worry about our people, we'll take care of them. It's kind of difficult to report back to the state that don't worry about these hospitals because their corporate people says they're going to take care of them, but they don't tell us how they're going to take care of them when they're hospitals in Illinois. So, yeah, we do need to share some more information, and we need to get on some planning with this. So, John, you are absolutely correct.
Greg, you know that the IDPH sent out a survey to hospitals. I think it was due last week, Tuesday, because I completed mine last week, Friday. I was a little bit late. But it was basically just a query of what resources you had and what you felt you could handle and what you identified yourself as far as Ebola goes. You're aware of that?
I was aware, yes, that it went out, but I have not gotten a report. I'm sure they haven't put everything together to send out a report, but I can certainly on our next staff meeting with Ashley find out if they're, when we expect to have that list finalized.
Yeah, it was worthwhile. I mean, it was pretty intricate, basically talked about everything from PPE to whether or not we felt we had transport mechanisms. And since I saw that we still had a policy in place, I put yes. So, so John, you're on the hook for that, whether you realize it or not. So, so that questions and answers have been sent out. So I assume they'll come up with at least an idea. I don't suppose they're going to find anything new from it. I think you're going to still find that everybody in this region and in nearby area identifies themselves as a frontline hospital because we couldn't get any. I remember back in 2014, no administration would say, yeah, we'll be that assessment hospital or that Ebola hospital. So.
Got it. So thank you all for that conversation. So again, I will echo those sentiments. Knock off the cobwebs. Start to just, maybe start to have some of those conversations within your organization. Are we at a high threat? No, we are still deemed at a low threat. Is the threat nil? No, but it is still assessed as low by both IDPH and the World Health Organization. So we will see how this all pans out.
I mean, that was the beauty, Phil, of actually sending the survey from the IDPH. The fact that it did call it, say, hey, we're shining a light on this, pay attention to it. And I'm sure you were aware that your facility got that survey as well. So, I mean, that was a good opportunity for a flag.
Yep. And I'm sure that's still one of that's the reason why my infection prevention nurse just ad hoc sent out that meeting request. So, all right. So again, the floor is open. Anyone with any announcements that have not been shared?
Hey Phil, Tim out at Scott. How are you?
Doing well, Tim. What's up?
Hey, I got a call from Miss Ann Robertson. She's a FEMA, I guess, voluntary agency liaison. Here doing, some work with the flood relief. Has anybody else in the group heard from her?
I have not. I don't think I have. The flood relief requests for, and they were specifically talking. You said volunteer.
Yeah, well, she was asking about faith-based organizations, getting out information for the community as far as looking for volunteers to help the elderly and anybody else that was affected by the flood that might need, cleanup help. But I was just trying to figure out where she's deployed to, what office she might be working out of.
Yeah, interesting. No, I have not. Has anyone else received any requests for information or information like that? And what was the name again?
Her name is Anne, Anne Robertson, Robertson.
Okay, thank you.
Hey, Phil, this is Jason with IEMA. It's not unusual that they would have what they call VALs, volunteers active, liaisons. At the state Illinois Emergency Management Agency, we do have Michelle Hannigan, and she would probably be at least a person that would be my go-to if there is somebody calling, if you need to verify or see exactly what FEMA is doing. It should be kind of going through that joint field office. Michelle's number, cell phone number, if you have a pen and paper, is area code 217.
Hold on, give me 1 second.
Again, area code. Sure.
I'm ready.
And her name is Michelle Hannigan.
All right. Got it.
Yep, Michelle. Her number is 217-524-6514. Anyone can take that number down if you have any kind of information about how these different groups might be active in any type of flooding or something like that. It might be worthwhile. So that's who I would probably reach out to first.
All right. Thank you.
It's in the chat, I see. Thank you.
Perfect. Okay.
That's all I got, Phil.
No, I appreciate it, Tim. Thank you. All right. Here's our upcoming events. Next coalition meeting is December 7th. The International Association of Emergency Managers conference, of which Lee and I will be attending, is 11 through 17. Your week after next or end of next week, we'll be leaving out of here. down in Savannah. The National Healthcare Preparedness Coalition Conference, 29 to 1 December. And those are some of the trainings that we have on the schedule right now. And I believe those are all hyperlinked. So if you do have those, if you do have a copy of the slides, those links should take you right to the registration pages. So we're trying to fill those up. Again, this is one of the asks. We're talking mental health for providers, et cetera. This is one of those things that helps build that up. So please take advantage of that. We do have more on the horizon coming up as well. We got a Decon Trainer course that's going to be held here from 8 to 12 December at Memorial Hospital in Belleville. This course right here specifically is targeting some of our partners on the west side of the river. Some of our BJC partners. We're trying to do what we did here, using some of the lessons learned from our Train the Trainer course that we conducted here. So this is a select group of individuals as a test run to see if we can actually create sustainable educators with regard to first receiver patient decon. So that's going on there. That's pretty much closed off. It's not an open. We're not asking for more volunteers. We've identified those individuals, and we're going to work with them. We'll kind of brief you on the outcome as we move forward. We'll probably talk about this a little more during our December 7th coalition meeting. We have our oxygen generator that we have parked here. It's a regional asset. We do have a training and maintenance course, 13-14 December. That's going to be right down here in Lee. It's escaping me. What's the French Village? We're going to do it over at French Village Fire Department. So we're going to get that squared away. We're going to try to make some more subject matter experts with regard to the oxygen generator, so we can provide this vital resource when we have instances where folks can't make it down to or get their oxygen bottles refilled or to support any kind of field operations. We're doing special events, or we have an instance where we got to do sustained operations somewhere else, potentially in an austere environment. We got that kind of training scheduled too, austere environment, patient care training. Again, your 2024 project proposal deadlines, 31 December. We did put that in the chat, and that link will go out as well in our email when we upload this to our YouTube page. And the IDPH Summit, it does say TBD, but it is going on. Is that right? That's right, Greg, isn't it?
Yes, sir. The planning meetings are getting organized right now for it.
Yep. No specific date, but it will be in normal.
It'll be in normal. There's a date. I think it's Beth, if you're still on, is it 6 through the 9th? It's that week in June.
Yeah, I put it in the chat. June
Okay.
6, 7, 8 in normal. Not exactly sure where in normal yet, but go ahead and everybody mark your calendar.
Great. That's great. So that'll be the first in 3 years. So great to get back to that and seeing some folks. So hopefully you guys will be able to attend. So if you can attend, please attend. Before we break, any last minute comments?
Hey, Phil.
Yes, go ahead, Tim.
We're actually going to do an air show next year, and that's going to require support from you and John and some other, local entities. Can you add that to the calendar?
Indeed, I will. So just shoot me the dates, Tim, and yep, we'll definitely make sure that that's on the calendar.
All right, thank you.
No, thank you. Appreciate it.
Hey, thanks, Tim. It's John. Yeah, Phil, I have a meeting with the Med Group tomorrow, and I will be passing off quite a few of the names from our community support. So expect that you guys will start receiving emails from the Air Show Committee.
Perfect. All right. Well, we're going to end it there. We'll give you guys.
Well, hang on, man. I got one more thing.
Oh, sorry. Go ahead, John.
Hey, I got to get a hold of Dan Lee. Halloween night. Is anybody aware of the not massive, But the incident that took place in East St. Louis, active shooter, Halloween night, well, actually, it would have been November 1st because it was after midnight. But I did send out a incident through EM Resource for a bed quarry, or just to let the local hospitals know that we had a very active shooter scene going on in the middle of East St. Louis. I noticed that only the Missouri hospitals received that. So I don't know if something's happened with either just my link or if they have separated the Illinois and the Missouri EM Resource again. They did that about 3 years ago through an update by accident. But did anybody receive that alert? Do you know of?
I didn't receive it. Greg didn't.
Yeah, and Phil, I didn't receive it.
Yeah, it was a
This
pretty.
is
Go
this
ahead,
is
I'm sorry.
Brody from South City, and I actually did not receive that alert either. I don't know if it went to just some hospitals on the Missouri side, but we did not get it.
Okay, well, there's a couple of things that I'm working on to get fixed, because it did go to just the trauma centers that I recognize. I am going to run a report, and Greg, I will also send that to you. It was kind of vital. I mean, again, you know, with all the active shooter stuff that's going on, we literally had that, like I said, Halloween night, and it didn't stop. It wasn't just one shooting, it was several within the area. But at just one nightclub, we had, 7 people that were shot and treated and transported. You also had several people, I mean, probably 25, 30 people, due to the mass chaos of running and stampeding, that people were just, jumping in cars and taking themselves. So I don't know if some hospitals received some of that or not, but I did try to get that notification out as soon as possible. It was kind of hard, and again, you get thrown into those situations, and we have all this communication, but when you're actually the one stuck in the middle of all this, it is kind of hard to get that out. So, me, I always use EM Resource, and so I figured for sure I could at least get that message out to everybody, but apparently it only went out to about 8 different facilities. So we got to work on that and make sure that when those notifications go out, that everybody can put those notifications out and they will go out. So just to let you know, that took place the other night.
John, it's Lee. For MCI notifications, they have to be sent out separately. There is no way to do a joint Illinois, Missouri MCI query. Those two are not linked any longer.
I did not know that.
On a different subject, the designated infection control officer class is at the end of the month. Is there going to be a sign up for that? So we know what the numbers are.
Probably on my desk, on my computer. What's up?
Sorry, Greg. I'm sorry. I mean, Eric. Your question was the DICO course.
Yep, DICO, blood-borne pathogen, November 30th, December 1 and 2.
Have you heard, hey, Eric, it's Lee. Have you heard from Kathy from the?
No.
Okay. Let me reach out to her, because I submitted the paperwork from our end, but I haven't heard anything further from her.
Okay.
So what I'll do is have her go direct with you, because you're hosting.
Yeah.
So that you guys can coordinate it from there.
Yeah, and if we would get, if that would be the case, then at least I would reach out to the EMS systems and see if they have people that they're sending. I had my people sign up, but I have it here in my office because, there was no place that was tallying everything. So I think you said we could go up to 25.
Yeah, that's correct. Yeah.
Okay. Which I think will be fine, but.
Okay. I will copy you on an email and we'll see what we can do.
Very good. Thank you, Lee.
Thanks for reminding, because yeah, that should be actually on this slide here. Okay. All right. We're right here at the hour. we're going to go ahead and break. If you have any questions, comments, concerns, please feel free to email us. You can always reach all of us at info@sewellhope.org if you don't have our specific email address. So we appreciate your time, and we're going to close it out here and see you next month. Take care.